Good afternoon, ladies and gentlemen. Good afternoon, Indonesia. Welcome back on Afternoon Breaking News with Andika Yudhistira. Reported by AP News, Trump get experimental drug aimed at curbing severe illness. The experimental antibody drug given to President Donald Trump has been called one of the most promising approach to preventing serious illness from COVID infection. Its maker, Regeneron Pharmaceuticals Inc., said the company agreed to supply a single dose given through an IV for Trump at the request of his physicians under compassionate use provisions. When an experimental medicine is provided on case-by-case emergency basis while studies of it continues. The new drug is in late-stage testing, and its safety and its effectiveness are not yet known. No treatment has yet been proved able to prevent serious illness caused by coronavirus infection. Trump was given the experimental drug at the White House on Friday. He was taken to the Walter Reed National Medical Center, where he will be watched. Officials said so far Trump has only mild symptoms, including fatigue. And several physicians who treat COVID-19, including Dr. David Bulwer at University of Minnesota, had speculated the doctor might use the antibody drug, given that this approach has worked against other diseases in the past. They're not just going to sit around and watch to see if he gets sick, Bulwer said. Earlier this week, Regeneron said partial research from about 275 COVID-19 patients who were not sick enough to need hospitalization suggested it might be cutting how long symptoms last and helping reduce the amount of virus patients harbor. However, the study has not been completed. The results were only announced in a company news release and have not been published or reviewed by other scientists. And Trump physician Dr. Sean Conley said late Friday that Trump had also been given the antiviral medicine called drug remdesivir at the medical hospital. The Gilead Science drug has been shown to help some COVID-19 patients recover faster. Earlier, Conley said Trump also was taking zinc, vitamin D, and antacids called famotidine, melatonin, and aspirin. None of those had been proven to be effective against COVID-19 though. Trump apparently is not receiving hydrochloroquine, a drug he widely promoted that has been shown in many studies to be ineffective preventing or treating COVID-19. Trump medical team will likely monitor his temperature, heart rate, blood pressure, and oxygen saturation. They'll be paying attention to all of his vital signs, Santos said. Since some people with COVID-19 have had low oxygen level before they notice a shortness of breath, monitoring the blood oxygen with a pulse oximeter can help detect a problem sooner. Santos said, "What we have recognized with COVID-19 is that the majority of patients, when they get sick, all at once decline. Symptoms can progress gradually, so constant monitoring is a key." And do Trump's current mild symptoms indicate anything about his prognosis? No. Having mild symptoms on day one does not mean you are going to have mild symptoms for the rest of your course, Santos said. Of course, it's possible that Trump may not develop any further symptoms, Santos added. But he said that given Trump's age, his weight, and his gender, the president has several strikes against him. These are strikes that raise the probability that his COVID-19 may go from mild to severe, Santos said. However, even if Trump's symptoms do get worse, doctors have learned a great deal about treating COVID-19. In the last of 10th month, Emory Kraft said, and as a presidency note, Trump is expected to get the most sophisticated care currently available. I expect that the president, with the attention that he will get, should do well. That's all for the afternoon breaking news with Andika Yudhistira. Thank you for watching and see you later.